Well, I'm really happy to talk about the Reproductive Health Action Plan and the BNPP's role in helping produce that plan. Um, the bank's executive board wanted the Human Development Unit to detail out how the bank was going to scale up on reproductive health, taking from the H&P strategy, which was developed in 2007. And what we had done prior to that, prior to May 2008, we had done a series of analytical work which was supported by BNPP, and there were various. One was, it was really to look at the forgotten MDG or MDG5, but it looked at various aspects. It looked at the issue of fertility and looked at the determinants of fertility as well as what the consequences can be, which a lot of work has been done, but it was really looking at the literature, synthesizing the literature, etc. And then we actually had case studies in 5 countries where countries which were able to make a change in their fertility levels and do a case study to see what contributed, what were the factors within the country. Was it service delivery? Was it a social a reform policy? Was it education of women? Was it the employment and mobilization of women, or anything else? I mean, and so it was very interesting because this gave us a lot of insight into what are the things which can make a change at the country level. And from there, and so this also, the same BNPP funding also helped us look at what was the bank doing in terms of its support on reproductive health, in support of population in the countries which have the highest fertility, the 35 countries which at that point of time had been identified as having the highest fertility. So we looked at the bank's lending and really looked at each of the countries and saw where were we supporting programs, what was the focus of the support of the program, where and how much was it. And it was interesting to see that even if we looked at the whole program, the support for the bank for these 35 countries, which should have been the highest, was really not so. So it sort of changed the thinking a lot. I mean, it provided the evidence to everyone, and it changed the thinking a lot. And it provided a lot of background information and evidence, which then fed into the Reproductive Health Action Plan. So in a sense, if you ask me what would have happened if BNPP was not there, I would say that we would have still had to develop the Reproductive Health Action Plan, but we would have had to really do some additional work, and we would never possibly have it had out by 2010 because we wouldn't have had this advanced work done. And what the BNPP helped us to do was to do advanced work. And in fact, when we did that advanced work, it was not with the idea of actually developing the Reproductive Health Action Plan, or REHAP as we call it, but it was really to find out what was happening in the bank. And so it gave us just the evidence we needed to do a background, sort of to fill the background in terms of what has the bank done in terms of this high fertility, high maternal mortality.